Okay, so I'm going to go over some of the organs and vessels of the abdominal area. So to start off, over here you have your skin, so obviously your most superficial layer. And then you have some fascia tissue right here called your, Camper's fascia. Here's your skin. And then in between your skin, or after the Camper's fascia, you then have your other superficial scapula, which is called your scarpia fascia. It's going to alternate colors. And then you have your superficial fascia. And then this is where your abdominal muscles will begin. So within the abdominal muscles, you will then have, we'll make little M's for muscle, and this is going to be your external oblique here. So that's going to be your external oblique. And you're going to have another fascia layer through here. The investing fascia. So you have superficial, here's investing. Oh, so I got my green back. And then here's where the abdominal muscles come in again. And this is external, this is going to be internal oblique. And then, you can tell I use these a lot, I'm running out. And this will be your deep. So obviously as you go deeper, it's deep. And then external oblique, internal oblique, and then you have your transverse abdominal. Your TA. And after your TA, this is where your perineal tissue is. The external perineal, because this is external, and your fat. And then right here, then you have your parietal peritoneal. So outward to inward, skin, your three muscles, your three main muscles. You also have a triangular muscle pyramid, which is through your external area, but not everybody has that. Okay, so that would be your fascia. Excuse me. Okay, so if you're going to do the muscles of the body, okay, here's my human. This is anterior. Oh. And posterior. Apparently I use the brown marker a lot. I'm running out. For your external, they run like this. For your external oblique. And they are around ribs 5 through 12. Now your internal oblique, they go the opposite and they kind of overlap a little bit. So your internal oblique, their ribs, 10 through 12, I think. Yes, 10 through 12. So these are ribs 10 through 12, externals 5 through 12. And then you have your transverse abdominis, which is your third layer. So first, second, third. Your transverse abdominis is around T7 to T12. So he comes around and he's kind of like this. Kind of goes this way, C7 to T12, and I'm making a big mess. And then, like I said, you have your rectus on the outside. That's your six-pack, your rectus abdominal area, and then your pyramids, which is right around in your rectus sheath, or anterior to your rectus, which is only absent in about 20% of the people. So about 80% of the people do not have that. Okay, let's move on. Okay. Let's see here. Okay, we can go into the nerves. We have thoraco-abdominal. We have subcostal. We have iliohypogastric. And we have inguinal. Never said that correctly. Okay. So basically for the thoraco-abdominal, it is in the distal abdominal area. So if we're going to draw a human, oh, he doesn't work either. See how hard I'm studying? I'm using all my markers up. You are kidding me. Well, I'm going to make him blue. Okay, here's your umbilicus. So distal abdominal, so thoraco-abdominal, he's from about T7 to 11. That's where the nerve is. That hits right around here. Okay, the subcostal, he's around T12. So he is right around, put him around here, right around T12. Then you have the iliogastric. He's around L1, and that's like your TA area, external abdominal. So he's going to be a little lower toward the belly, and then you have your iliolingual. Iliolingual, am I saying that right? And that is right around your second and third abdominal muscle transverse area, genitalia area. So he's going to be a little bit lower around L1 as well, but below. So there's how you go with that. And you can say about, if you want to do some landmarks, this is around L3, your ASIS. Right below there, it's usually like L4-ish. Your epiglossal fossa is up here. And there you go. Let's move on. Okay. Let's move on to spleen, pancreas, liver, biliary ducts, gallbladder. Okay, oh, gallbladder. Let's make it green. Here's your gallbladder. what do we have here? So it comes out here, and you're going to go up to your right and left hepatic duct. Ugh. And then here's your common bile duct. I think it's just called bile duct. Back in the day, it was common bile duct. I think they changed the name. And your common hepatic tract. It's right through here too. Okay, so right underneath, and here's your cystic duct, by the way. Right underneath that is your duodenum. Duodenum. Okay, so if I was going to take all this and shrink this to show you where it is in the rest of your body, I can do that right now. Let's draw some larger pictures. Here's your diaphragm. Just make this come on down like this. And here is where your liver is. And here's all your ducts going to your liver. Here is where your gallbladder is in the middle of all this. And let's draw some arteries. So, so there's all your veins. Hepatic vein. Through here you have your gastric artery, splenic. I kind of remember this from when I dissected somebody several years ago. And it comes right out like this. And then this, of course, is your aorta. And it branches off this way. Okay, a little sloppy, trying to go fast. And sometimes they have to remove some parts of the liver, like a hepatic lumpectomy, or a segmentory portion of it. Or do a biopsy in the liver, where you have a needle puncture right over around, if they're going to biopsy, they usually do around T10 so they don't puncture your lung. You can have cirrhosis of the liver. That is from alcoholic beverages. We'll just draw that there, cirrhosis. And what happens with cirrhosis is your hepatocytes, am I saying that right? Get destroyed and it's replaced with fibrotic tissue. For your colostomy, the biliary colic, common bile duct, what happens, that's with your portal hypertension is what happens with that. Your liver, usually around the ribs at 7 through 11 is where you usually palpate. And where is the pancreas in all this? I forgot to draw the pancreas in. Okay. Your pancreas through your glucagon, that's a whole other chart. For insulin control, glucagon, insulin, diabetes. That's a whole nother phys class. Okay. Okay. Do you want to talk hernias? Hiatal hernia. So hiatal hernia is basically protrusion